the work of a farmer is never done, so it can be very difficult, to find times, to go to the GP, and looking after your own health. But they do, day in, day out, they take care of the machinery on the farm, the livestock, and all of that. But all of that comes second nature to farmers. But, to make sure that you're looking after yourself as well and managing your own health.
Hello and welcome to the Beef Edge, the Teagasc beef podcast, for all your latest news, information and advice for Irish beef farmers. I'm Catherine Egan, and with farmers 7 times more susceptible to a cardiovascular disease, I'm joined on this week's show by Annie Costelloe, Head of Patient and Community Engagement, and Caroline Dermody, Community Nurse with Croí, to discuss some top tips and advice relating to your health. Annie and Caroline, you're very welcome. Before we start, Annie, can you give a background on what Croí is and what you do?
Croí, the Heart and Stroke charity, has been in existence now for nearly 40 years. We're based in Galway in the west of Ireland. We began with very much having a focus on the west of Ireland, but in recent years our wings have spread far and wide, and I suppose the onset of COVID facilitated that in a big way, allowing us to deliver our message virtually through digital virtual programs, that kind of thing. So our aim really is to lead the fight against heart disease and stroke in Ireland, and to prevent disease, to save lives, to promote recovery and well-being. Prevention being the optimal word there, I suppose. It is all about prevention. We don't want anybody to ever have to have an event or to suffer an event. But if you do suffer an event, you or a family member, then we do have a certain number of wraparound supports that we can offer to help you in your recovery and to ensure that, it doesn't happen again, that kind of thing. So prevention, that's about raising awareness. It's about, education and people understanding the risk factors that my colleague Caroline will talk about in a moment, the risk factors that can lead to somebody having a cardiac event. And we can start prevention, at the cradle. It doesn't need to be that somebody at 40 or 50 or 60 years of age just suddenly should start thinking about it, even though it's very important at that age, but we really should be thinking about it a lot earlier in our lives. So prevention on the one hand, and then if we do suffer an event, to know that Croí, through our community work, through our nurse helpline, Croí Connects, that we are here to support you and your family through signposting, through exercise programs, education programs, in terms of living well with whatever the condition is that you have been diagnosed with. So that could be post a cardiac event, or it could be living with something as simple as being diagnosed with high blood pressure, and the things that you can do to manage that and make sure that you live a good and healthy and long life as a result.
And the life of a farmer is very busy and very active and often unpredictable on day to day as to what will come up. What impact does that have on a demanding lifestyle on the farmer's health?
Well, again, I mean, we see farmers all the time out and about in the communities, where Ireland is a very rural country, as you know, and regularly we're meeting farmers, we're meeting their families, the people who are living with them and working with them and concerned about them. Farmers are men and women, they're young and old. And they tend to be more worried about their land and their livestock and their livelihood than they do about themselves, in our experience. So they look after everybody else and make sure the whole world is fed, and that their cattle and their sheep and livestock are well looked after, but they don't necessarily consider looking after their own health. And the fact is, running a farm now is a busy job. It's a business. Some people are doing it full time. Some people are doing it part time. The guys who are doing it and the ladies and the men who are doing it part time are presented with all sorts of stresses, because they're trying to keep up a full-time job and they're trying to keep the farm going. So that presents stress. Stress is a significant risk factor for heart disease and stroke. That, coupled with then maybe knock-on effects of not eating, not sleeping, not getting enough exercise, can lead to suffering a heart attack or a stroke, or living with a cardiovascular disease. And then for the farmers that we meet that will say to us, well, I'm very busy and I do lots of exercise and I'm walking the farm every day. I suppose it's about us engaging with that community for them to understand that there is a difference between physical activity and getting the required physical activity that you need for optimal heart health than just walking around, feeding the cows and that kind of stuff. That's not necessarily exercise. And then, of course, that coupled with diet and all of that kind of thing has an impact on the everyday life of a farmer.
Caroline, from what Annie has said there, what are the kind of lifestyle changes that farmers can make that'll have the biggest impact to reduce health issues?
Really, what farmers need to do is arm themselves with the information about what risk factors are and what risk factors they have themselves. So first of all, to understand exactly what a risk factor is. So, a risk factor is anything that raises a person's chance of developing heart disease and stroke. So that's something that you're doing on quite a regular basis. That will have an impact on your health. And the more risk factors you have, the more likely it is that you will develop heart disease or stroke. You can make a big difference to your chances of experiencing heart disease or stroke by making changes that will improve the risk factors that you can control. And a risk factor, really, there are two kinds. So the ones that you can control, and there are risk factors that you can't control. So the risk factors that you can't control, but you should have knowledge of, are things like your family history. So, if somebody, a sibling or a parent, has had a heart attack or stroke, that can make you at a higher risk. So to know your family history, if you can, being male or female can have an impact as well. So women, the one benefit of having hormones and all of that is that we have some protection until after the menopause. So men are at a higher risk kind of from the age of 55 and women are around 65. So it's just to be aware of that. Your age, unfortunately, as we get older, the risk factor increases, and our race as well is something else that we need to be aware of. For example, if you're African Caribbean, you can have a higher risk of having high blood pressure. So they're kind of the risk factors that we can't control. But then, luckily enough, there are risk factors that we can control. And those risk factors, that we need to have a knowledge about and to know the numbers about are your blood pressure. So it's important to know your blood pressure level. Your cholesterol, you should get your cholesterol checked. Your smoking habits. So if you smoke, that is a very huge risk factor for getting heart disease and stroke. Another blood test that we can have done to check is for our blood sugar levels, and that checks for diabetes. And if you have diabetes, you are at a higher risk of getting heart disease or stroke. So there are a number of risk factors, that are within our control. The other things then that we need to be mindful of, is our physical inactivity. So, I know farmers, they always say to me, they're out on the land, but I see a lot of farmers in jeeps and quads and stuff. So just, physical activity isn't the same as exercise. So just to be aware of how much exercise they're taking. Our weight is another risk factor, and especially carrying weight around our tummy area, that increases our risk factor. And stress. So having, unfortunately, stress is in everyone's life, but if we have a constant chronic stress, that's when it becomes an issue, and that affects our blood pressure, our cholesterol levels. It also impacts then on what food we eat, our diet, what exercise we're doing, like if you are smoking or your alcohol intake, it all has an impact on that, and our sleep. So there's a whole combination of things that we need to be aware of, but they kind of are the main risk factors that we look at when we're chatting to people. And I suppose for the farmers and the whole family, so it's not just the farmer themselves, so it can be the farmer, their partner, if they have children, it all impacts on them. So it's just something to be aware of.
Most definitely, Caroline. And I suppose farmers will have seen Croí attend local marts across the country over the past number of years, and this is ongoing. Annie, from a farmer's point of view, when they see your stand at the mart, can you just talk through the process as to when the farmer sits down, what tests you do, what kind of questions you ask the farmer? Because sometimes it can be daunting when they see this at the local mart. What's the actual process that you go through with the farmer?
like at if we're outside at a mart or anywhere else, they're more than welcome to come over. We're very friendly. It's not very a formal setting. So when the farmer will sit down, we'll get them to sign a form just to say that they're happy for us to do their blood pressure, and that they'll take on board the information that we give them. Then we will check their blood pressure. So that involves placing a cuff on their arm. So it's not very invasive. You won't be removing any clothes or anything like that. You just have to roll up if you have a long sleeve on. So they'll be sitting down. We'll check the blood pressure. We'll talk about their blood pressure reading. We also will be checking their pulse, and that's just very important to make sure that they have a regular pulse rhythm. And once we have all that done, then we can have a quick chat to them about any risk factors that they might have any questions on. So that can be cholesterol, smoking, it can be diet related or exercise, or whatever really they have an interest in. So that's kind of what the process done. If we do find anything, so say if we do find that their blood pressure is elevated, we can recheck it again, and we can talk about the best steps that they need to take from there. As Annie mentioned earlier, we do have supports outside of that to offer. So we do have our phone support line, and that they can contact us, and we can follow up with them from there.
The reason you will see us at a mart is because we've discovered over the years that farmers aren't great, as we have said earlier, at getting themselves to the GP. So working with local organisations like in Galway Rural Development, or with organisations like Teagasc out and about in the community, we are invited to marts where farmers are already gathering, where we try to make it as easy as possible for them to avail of the check. And once they've had the check, then and we do find regularly, and our reports have shown this, that lots of farmers, although they are getting better, I will say, but lots of farmers will not have visited their GP in quite a while for anything. And they also, if they are on medication, they may have been on the same medication without any follow-up. They haven't gone back to their GP to follow up or to inquire whether something should change, in the years since. So it's very important to kind of make it easy for the farming community to avail of these checks, and just to kind of, I suppose, re-emphasize the importance of it for themselves, for their lives, for their family lives, for their farm, the whole package, that they do take that opportunity wherever possible. And then that might prompt them to maybe be a little bit more proactive in the future in terms of looking after their heart health, because it's core to their, making sure that they're running a good business and being there for their families in the future.
And over the years, Annie, you visited a lot of marts and met a lot with farmers. What have you seen as some of the standout cases that listeners can learn from?
Yeah, I mean, it's one of the most enjoyable things that we do as an organisation. It's always a really enjoyable day out to meet with the farming community. It's always great fun, but also, as we said, underlined with a little bit of seriousness. And we have had occasion where we have met farmers, male and female, who have been identified in the day as being in need of immediate help. And in some occasions, very, very immediate help, whereby maybe an ambulance might be called for somebody to make sure that they get to where they need to go to ASAP. And on one occasion that I recall, a few years ago, the gentleman was taken off. Now, it turned out that he did have a very strong family history, but I guess he was just not dealing with it. Very strong family history. And on the particular day that he met with our nurse, his blood pressure was extremely high. She did all her protocols in terms of, the different tests. And as Caroline has said, this is not a diagnosis when we meet you on the day. It's not a diagnosis. It's a moment in time. And it's a like, it raises a flag or a red flag to you that you need to go and get something checked. But for whatever reason, this gentleman's blood pressure was just not doing what it needed to do on the day. And in conversation with him, and the fact that he had a very strong family history, the decision was made, given the readings, that he needed to go immediately to A&E. And it turned out that this gentleman did have an event did end up having a life-saving procedure on that very day, and is still around to tell the tale. But that's one extreme case. You don't see that often, and that's not to frighten people, but that is one very extreme case that does stand out with me over the years. And that life was saved, and that man's family have him with them today. Other people over the years, of course, it might not have been as severe, but they would have gotten the nudge or have gotten the tap on the shoulder that gave them the impetus to get themselves to the GP, get themselves checked out, have a diagnosis of something, whether it be high blood pressure, high cholesterol, or maybe something a little bit more serious, maybe an irregular heartbeat, as Caroline mentioned earlier, which is a very strong risk factor for stroke. Get that addressed, get it sorted, get it managed, and then begin to, get on with your life, basically, but know that you're managing that risk factor or that condition. So it's very important, and that's the value and the impact that we see on a daily basis. You might see 100 people, and you might have a real impact on 3 people, but that's worth it.
Most definitely, Caroline and Annie, for sure. It's making a huge difference, particularly for the farmers' health and well-being and the family going into the future, as you've mentioned. We've really covered a lot in the last few moments, particularly around preventative measures that listeners can take now. I suppose we've seen from what you've said, really, cardiovascular disease isn't an older person's problem, but really small changes that's made now. It's never too late to start. What would you say are the 3 tips that you'd give to listeners from all that you've seen and from what you've said today, what that they should take for it? Annie, maybe you want to give 2 or 3 tips, and Caroline, I'll come to you then.
Perfect. Yes. So I'll start probably from a more general perspective, I suppose. Number one, as you said, it's not a young person's issue, or sorry, an older person's issue. It is almost a community issue. We need to start thinking number one, we need to take ownership ourselves, but we also need to start thinking in terms of, building healthy communities, looking to see what we can do to empower people to be aware of what they need to do and then to actually do it. So whether that's within a one-on-one within a family situation, whether it's in a wider family circle, a friend circle, schools, organizations like Teagasc, it's incumbent upon all of us at various levels of society to really do what we can to facilitate people to, number one, understand the risk factors for cardiovascular disease, and then to focus on cardiovascular health, because it's cardiovascular health is where we want to be. We want to be cardiovascular healthy.
That's great, Annie. And Caroline, what advice would you have?
Yeah, so I suppose kind of to reiterate there what Annie said, we have a slogan that we use here in Croí of own it, check it and sort it. So really what I'd be saying to farmers is to make the time and don't have any regrets, to know your numbers and know your risk factor, to know your blood pressure reading. And the only way that you can do that is to get it checked, whether it be with the GP, whether it be with the practice nurse. The pharmacies are very good now at checking blood pressure. To know your number. Is your blood pressure reading below the guidelines of 140 on 90? To have that blood test done, to check your cholesterol, know the difference between your bad cholesterol and your good cholesterol, your blood sugar readings, and they're just the basics. And I suppose after that, from my own point of view, exercise and stress management would be something that would go hand in hand and really benefit everything. Exercise has such a powerful impact on us. It affects, our mental health, our weight management, our blood pressure levels, our cholesterol levels, and our blood sugar levels. So from a nursing point of view, they would kind of be the main things. But the main thing I'd like to get across today is, to make that time. The work of a farmer is never done. So it can be very difficult, to find times, to go to the GP, and looking after your own health. But you do it, as Annie said earlier on, they do it, day in, day out, they take care of the machinery on the farm, the livestock, and all of that. But I suppose you have to think, all of that comes second nature to farmers, but, to make sure that you're looking after yourself as well and managing your own health. So, checking for signs of a problem and taking action are just as important for yourself as it is for your farm. And, to look after yourself really and to prioritise that.
A lot of insight there in relation to cardiovascular health, and there's further information on the Croí website on www.croí.ie. And farmers can look forward to seeing you in the coming months at their local mart across the country. And those dates will be available on the website also. Thanks very much.
They will, absolutely. And can we give the nurse helpline, Catherine, please?
You can, yeah.
So if they would like to just pick up the phone, 091 544 310 is the cardiovascular nurse helpline. They'll get through to our colleague Maeve, who is a cardiovascular nurse specialist, and she will deal with any queries or issues that anybody might have. And that's a free confidential service. So anybody is free to call that number Monday to Friday, 9 a.m. to 5:30 p.m.
That's great. Thanks very much, Caroline and Annie.
Thanks very much.
Thank you very much.
That's all for this week's episode. And my thanks to Caroline and Annie for joining me on the show. You can catch up on all other shows and interviews from the Beef Edge podcast on the Teagasc website at teagasc.ie, or you can listen on Apple and Google Podcasts as well as Spotify. Don't forget to rate, review and subscribe so you never miss a show. For all other updates from our beef programme, keep an eye on our Twitter and Facebook pages. Until next time, I'm Catherine Egan and thanks for listening.